looking at the experience of COVID-19, which was one of the massive shocks that affected the entire world recently, it shows us that even though the pandemic was global in terms of its health effect, the reaction capacity varied widely across countries. That is true for the vaccines, where we saw over time the vaccines becoming available in the richer countries and more available, and then the middle-income countries, and then nothing in the poorer countries. We also show that in terms of the ability to fiscally protect citizens. The extent of fiscal stimulus measure across countries varied widely in the COVID-19 pandemic. In particular, the richer countries spend about 25% of their GDP in fiscal stimulus measures, whereas the poor country, the poorest of the poorer countries spend 2% of their GDP on fiscal stimulus measure. And of course, that's a much smaller GDP. So 2% of a much smaller GDP is really very little money. And as a result, if you look, for example, at the African continent, but that's true also for Central America, even though the number of victims of COVID was not higher, the lingering effects were very large in those places because they were not able to shield their citizens, and what could have been a temporary loss in income, like it was in a country like Chile or in France, became something much more permanent in those poorer countries, which in fact they have not yet been able to fully get out yet. So I think what the COVID-19 experience tells us is that we cannot wait for a disaster to strike and then see whether we are able to help out. Because it is kind of a moment where the entire world was looking at the crisis like a deer in the headlight, trying to see what they could do for their own citizens, scrambling to find vaccines and to put together programs. And it was not a time where any individual countries was really able to focus on what's the impact for the rest of the world. And therefore, the solidarity reactions from the entire world were very limited. The financial flows were limited, and the flows of vaccines were limited despite efforts to try and create a fund with the COVAX fund. So I think it's very, very important what this seminar is about today, because it shows that the COVID-19 experience shows that it's critical to be prepared before a crisis hits with systems and automatic reactions that can take place like almost without thinking and without going through a political process yet again. In other words, we need to agree politically of what is to be done in the face of a given disaster. And we also need to be ready logistically to make that happen without waste of time. And that's why a seminar like today is critical. So what form can it take? Well, policymakers, of course, have a variety of social protection programs at their disposals, cash, in-kind transfer, school feeding program, public works, graduation programs for the ultra-poor. They also have sectoral help. So what would work? What we need is rigorous evidence of what can be effective to help people protect themselves. Do we have any of this evidence? Well, it turns out we kind of do. Over time, there has been more social protection program, particularly, I should say, with the example of the LAC region, Latin America and Caribbean, which was really a pioneer in terms of extending social protection programs. COVID-19 expanded social protection program and reminded us of its relevance as a social insurance tool. It's important for those in poverty, but it's also important as temporary transfer to avoid people falling into poverty, out of which it's very difficult to climb back. It's more efficient from the point of view of society to protect people and to avoid for them to fall down from trap where it will be very difficult for them to get out of and contribute. And this is what social protection should be. This is the role that social protection should play in this particular context. So in other words, I want us to think about social protection as a form of adaptation. From the point of view of a country, if we are ready to provide people with quick help in reaction to a shock, That will be ex-post adaptation for people, because they'll get the money once the shock hit. But it's ex-ante adaptation from the point of view of society, because society is ready to come to help whenever it's needed. And moreover, knowing that, the household will be ready. They will know that it's coming on. For example, they know that it's too hard. They don't need to go out to work today because they will be supported and they'll be able to feed their family.